Nearly 9 minutes past 8. Kent Police says it's being forced to hold some mentally ill people in police cells due to a shortage of NHS beds and delays in assessing patients. The force says its officers are spending an increasing amount of time looking after people who have serious mental health problems and transporting them to specialist units. Kent's chief constable has written to the health bosses urging them to address the issue. Here's Assistant Chief Constable Paul Brandon.
We have to take them to a police station as a place of safety, albeit a last resort. We seem to be increasingly using them. And then obviously when they're there, we have responsibility because of their vulnerability, almost in most cases, to give constant supervision, tying up police officers whilst we await for the various assessments to be conducted.
The Kent and Medway Social Care Partnership Trust has been sending an increasing number of patients detained under the Mental Health Act to be treated in private hospitals many miles away from their homes. Andy McNichol is community editor at the publication Community Care. He explains why patients are being sent out of the county.
They came back with two main reasons. The first was that for some very specialist mental health care, services sometimes aren't available in every locality but are available regionally. So you might have something like, for example, specialist eating disorders. So in that case, someone might have to be sent out of their area to a clinic that takes people from all over the country or all over a region. And I think there's good reasons for that. I think the second reason that trusts say they're sending people out of area is simply because the demand for inpatient beds was exceeding their capacity. So what you have is you have people who are maybe being detained under the Mental Health Act that are in acute mental distress. And there is a duty to find them a hospital bed, but if the NHS can't provide it, then sometimes, and seemingly increasingly, they're being sent out to private hospitals. So the NHS basically buys or rents that bed from the private provider.
Now,
there we go. Andy McNichol, community editor at the publication Community Care, talking to John earlier. Well, listening to that is Nick Fairweather, a medical negligence lawyer based in Canterbury. Good morning to you.
Good morning.
So we're talking about a multitude of things this morning, but we're starting with the fact that Kent Police says it's being forced to hold some mentally ill people in police cells due to a shortage of NHS beds. They're saying, and this feeds into what's the state of play on that one in the county. Is it something that you recognise?
Yes, absolutely. And this really is all about cuts, first and foremost. We in East Kent have lost beds on a huge scale. Over the last 2 years, the entire mental health facilities at the William Harvey Hospital, 3 wards have been closed. There have been closures in Thanet and further afield from us, but it's an area we still cover. There are closures planned in Medway. And this is a bad thing for 3 reasons. It's a bad thing in terms of public finances, because what might seem like an attractive cut in frontline services on an initial balance sheet, of course, doesn't play out like that, because these are statutory duties that this trust has to discharge. And patients still come through the system, and lo and behold, because they've shut lots of beds, there's nowhere to accommodate them.
So where do they go?
Well, they partly, as your data shows, they partly go out of area, and there's been a 7-fold increase in the expenditure on private hospitals on the part of the trust over one financial year, and it's nearly now £1 million. And so it's firstly a tragedy for public finances, because those figures just don't add up and will end up in a deficit. Secondly, of course, the knock-on effect is felt by other service providers like the police, because if you've not got local facilities, the police increasingly are left shouldering the burden of ferrying people wider afield, both in county and then further still to. I mean, we've had clients who have been taken to Roehampton, to Chelmsford, down further on the south coast, and that's all taking up vital and valuable police time.
Absolutely. So it's a strain on the police, but also for the people involved who have a mental disorder. They are not well.
Yeah.
I mean, these people are being handcuffed. handcuffed, aren't they?
Exactly.
And put into police vehicles and driven a long distance, which
That's
can't be
exactly
helpful,
right.
can
and
it?
And that's the third thing, and it's obviously the most important thing from our point of view, because, of course, it can be a very delicate thing as to whether someone properly belongs in a hospital receiving treatment or whether they properly belong in the criminal justice service. And if you don't properly resource things at the top end of that decision, then people can often stay in the criminal justice system inappropriately. And you speak to any prison governor, they will tell you that their prison is full of people who shouldn't be there, who have mental health problems. And even when the decisions are taken are right, and as you're rightly saying, even when people have to be ferried around, they're being ferried around by the police, and they may be being ferried around to assessment suites before they've even been assessed, and they are handcuffed, and they are in a distressed state, and they are mentally unwell, and that more than the finances and the drain on the police resources, that really is a disgrace.
And it does seem to be it's our complete still inability in our society to recognise a mental health problem as a condition. It's the same like a broken leg would be a condition. We had Ian Poynton from the Police Federation on in the last hour of the show, and he said, well, you wouldn't take someone who had an appendicitis to a police cell, would you?
Well, absolutely.
You'd take them to where they needed to be. We did ask the Mental Health Trust for an interview this morning, but they declined. But they told us this. They said in recent months, we've seen some spikes in demand for inpatient beds, although their use of beds has increased. Each placement has usually been for a very short time before bringing a person back onto the trust ward. On the criticism about Kent Police being overstretched now because of not enough help from that quarter, they say they're currently working with the police to limit the duration of assessments. But obviously they've made no mention there of the fact that their funding has gone down and they're closing units. What needs to happen, do you think?
Well, I mean, I'm not in charge of large amounts of public expenditure, and of course there's austerity and there's pressure on public finances, and I understand all this. I just wish people, if the right decisions are made at the outset, and if that's properly resourced, it saves money in the long run. And I would just say, when the trust talks about spikes in demand, I mean, the figures are that in 2011 to 2012, 20 people were taken out of area. In 2012 to 2013, it was 126. That's a sevenfold increase, and they cost an average of £8,000 each.